ages?
Well, what you need to do when you come down in February is to call us, and either coming down, or when you're want to just to take a day trip, come up and just check out the area.
That's not a bad idea.
See if that's something you like.
Do you have any idea what drive time would be? 2 hours?
No, not that.
Hi, I'm Sandy Thompson, your host here tonight on Senior Spotlight on PBS 39. We love it when you join us here. We always have a lot of good information. Now, this is a very important time of the year. If you are on Medicare, or perhaps your parents or grandparents are, they have some big decisions to make in the next couple of weeks, and that is if they want to have any supplements, or if they want to have some additional insurance coverage, an Advantage plan. What does all that mean? What are they, and how do you go about picking them? Can you change it? What are your priorities? And it's different for every person. So I have an expert here tonight. He was with me on Senior Spotlight a couple of weeks ago, and we just didn't even get through a tenth of the information. Greg McDonald, folks, and he is an insurance professional that is very, very knowledgeable about Medicare and everything. Now, you probably have already gotten your new 2014 Medicare guide. Well, there's a lot in this. It's a pretty big book. However, it's not everything. It's kind of hard to understand some of it even. I'll read something and it's like, okay, all right, read this again. Make sure I understand. Mm-hmm. Plus, there's a lot that's not in this book that you just have to know as a regular person.
Well, there's a lot of information, and there's a lot of nuances to the different plans, trying to figure out which is going to be the best one for you.
Now, does say somebody has their 2013 Medicare book, mm-hmm. and they looked at that and made all their decisions a year ago. Are there going to be changes in this, or does Medicare ever have many changes?
Medicare itself hasn't changed a lot year to year. We see some subtle changes in it, but for the most part, the plans, Medicare A and B, have not changed much. The co-pays and the deductibles change a little bit. But
go up a little bit.
Go up a little bit. The premiums go up a little bit, all that type of thing. But the information itself, the way the plan or the parts B and A work, they're pretty much the same. You know,
we talked when you were here before, Greg, about what is A and B and C and D. You know, if you've never been on Medicare before, and I imagine there are probably a lot of you that are new to this whole thing, if you're just recently entering that part of your life, and it's very confusing. And what does that mean? I wish they would give them the names of what they are instead of A, B, C, D. So help us out here.
Well, real quickly, A is primarily what happens in a hospital.
Okay.
Okay.
So hospital coverage.
A is primarily hospital coverage.
Okay.
It also can be skilled nursing coverage if you've been in the hospital for 3 days, 3 nights.
Okay.
It can also be home health care and hospice.
Okay.
B is everything that happens outside the hospital. It's your doctors, it's your facility charges, it's the ER. So anything that happens not as an inpatient, but when you go to the doctor, that's Part B.
So, some people might be using something from Part A if there is a hospital situation. Most people are going to be more concerned about what's in Part B. That's kind of our daily life. Gone to the doctor, doing this and that, whatever.
Yes, very much so.
Okay, but ER
ER
is the only part of the hospital that's in B.
Right. It's
Okay.
A is if it, as an inpatient.
Okay.
As an inpatient.
Okay. All right. And then C.
C is the Medicare Advantage plans.
Okay.
And so that Medicare Advantage plans is when Medicare, the government,
Yes.
actually takes out an insurance policy on one of their recipients.
Okay.
So that when a claim is paid, the insurance company pays the claim and not the government. That's
Right.
Part C.
And this is where it's tough to make a decision, because if you want an Advantage plan, and that's optional.
Yes.
Okay. We're going to talk a little bit more, Greg, about how to pick those out.
Okay.
But also the fact that, you know, it's the insurance company that's taking care of it. It's still coming out of Medicare, but the insurance company and Medicare work together, and you're just on the other end.
Yes.
Is that right?
It's just a matter of how do you want to receive your services.
Yes.
And each way of receiving care, whether it's original Medicare, Medicare with a supplement, or an Advantage plan, they all work. It's a matter of which way do you want to receive care. And you really can't make a mistake on this. Can you save money perhaps 1 year in one system versus another? Yes. The selection is primarily based on what historically how have you received your health services? And
Okay.
that can help you choose which type of plan is best for you.
All right, hold on to that thought, because I want to do Part D, a definition of that, as we go through this process of A, B, C, D. Okay, D.
Part D is your prescription
that's
drugs.
Easy to remember. D
drugs.
stands for drugs.
Right.
Okay, so that's prescription coverage.
Correct.
Okay,
Correct.
now, as I recall, Medicare doesn't give you prescription coverage unless you purchase
A plan.
a plan.
Right. And D is always offered by a private insurance company. That is not offered by Medicare itself.
Okay, okay. So you wouldn't, if you wanted coverage for Part D drugs, you would go to an insurance agent and purchase that.
Correct.
Okay, all right. I think a lot of people are confused there. I mean, you think that you can just go ahead and get everything through Medicare, but you can't. This is kind of the day and age where the government isn't everything. You have to search for some of your own resources that work for you. Now, Greg, let's go back to what works for you. You said you can't make a mistake. If you're going to go out and purchase a supplement or an extra insurance coverage, you said you could save a little money maybe. Is that a big amount from company to company?
It's not so much the price of a plan as much as what happened to you during the course of the year. Okay, sometimes.
The previous year,
well,
okay.
or what happens as you receive health services over the
Okay.
course of a year. Let's say, for an example, someone has a Medicare supplement, Plan F. Plan F works by covering really all the copays and deductibles that you might incur if you just had original Medicare. So if you go to the doctor, you go into the hospital, you really don't have any copays or any out-of-pocket when you receive services if you have a Plan F. Okay?
Okay.
Now, Plan F doesn't include drugs. We're just talking medical services.
Is it a supplement you'd purchase from Medicare?
You would purchase
Okay.
that from a private insurance company.
Okay, so
So this-
drugs and Plan F
Supplements, Plan D, which is your prescription
Yes.
drugs, and Advantage
Are
plans
from a separate insurance
are
company.
always from different insurance companies. Yes.
Okay.
Yes.
Okay.
So if someone buys a Plan F
Mm-hmm.
supplement, it's really like having a fixed cost for your medical services.
No
'Cause-
surprises.
So there's no surprises. You're going to pay a fee. We'll just pick a number and say $150 a month
Mm-hmm.
that you're going to pay. And the beauty of it is that's what you're going to pay for medical services for that
no
year,
matter what they are.
as long as it's covered by Medicare.
Right. I know the insurance
Okay.
companies have to cover everything that Medicare would.
Correct.
Okay.
Correct. So that's the caveat. Is it covered by Medicare? If so, and you have a Plan F, you're not going to have any out-of-pocket expense.
Yeah.
Okay, now we flip it over to an Advantage plan. Advantage plans have lower premiums, but you have copays when you go to receive services. So
right. A
if-
$40 doctor
doctor
visit
visit or
whatever.
something like that. You know, the copays vary. But if you're healthy and you don't go to the doctor very often, can you save money on an Advantage plan? Absolutely.
Right.
If you have lots of different health issues going on, let's say you have Parkinson's, let's just pick that out, and you have lots of services that are going on throughout the course of the year, would you be better off with a Medicare supplement? Probably, because you know what your costs are going to be, and you can go wherever you want to go
Yes.
to receive services.
Okay, now we do have a phone call coming in here from Marlene, and by the way, the number here is 969-2720. You've got free advice right here, won't cost you a thing, so give us a call with any questions you might have about the whole Medicare issue and separate plans that you can buy, because I know it can get pretty confusing, and maybe you might be interested in changing if you haven't been real satisfied with your plan before, and you have, let's see, from, well, we're already, it's already in effect. You have from October 15th until December 7th, that period of time to make a change or to make a selection. And we won't be very long until December 7th will be coming up. So anyway, give us a call if you have any questions. We do have a question coming in right now from Marlene. And if you don't prefer not to talk on the phone, that's okay. Our phone operator tonight, that's Justin, will be answering the phone back in the control room, and he'll take your question and type it up so I can read it to you here on the teleprompter. And Marlene says, I'm on Medicare. Is it true that I have to have a consultation with my doctor about death? Does that make sense?
I'm not sure what she's referring to on this one, about death.
Okay, Justin, look at that again. Any prearrangements about your end of life?
Well, in that case, it's not so much your doctor that you want to talk to. If you're looking at, you need a living will.
Right.
Do you know, what's your healthcare
Power of
representative
attorney.
going to do? How are you going to handle those decisions if someone is incapacitated? That's a living will. That's a power of health attorney. No, that is not part of Obamacare at all. That is one of these things where we've always had this arrangement. I shouldn't say always. We've had it over the past few years. It gives you an opportunity to determine how you want your end-of-life care to happen.
Yes.
In the event that you have a terminal illness and you can't make decisions for yourself.
Right.
But you need to talk to an elder law attorney for that.
Okay, and in fact, I'm glad you mentioned that. That's what our show's about next week. We have 3 attorneys on who are specialists. They're elder law attorneys, and they're going to be here. So we'll let Greg answer the Medicare questions and the insurance questions, and then you can call us back next week if you have more specifics about that end of life sort of situation. Right. Greg, as we're talking about these different plans, and as an insurance professional, what do you find more people come to you about? What's the biggest question or confusion or issue?
Well, when people are turning 65, they really don't know which is the best way to go. And they're confused about what Medicare is and what are the options.
It's new. I mean, it's really tough.
It's a totally
because
different system.
You haven't had any experience in that before, and all of a sudden you have to make all of these decisions.
Correct. And so what I do with my clients is I sit down, we just go through what Medicare is, so they understand A and B and D, and then look at the different options, supplements, advantage plans, and then I try to determine what plan are they most comfortable with. Yeah. And then once we do that, then we determine, well, we have this system, which plan within that system works best.
I mean, different insurance companies?
There are 10 different Medicare supplement plans.
Now, I understand those are all like approved by Medicare. Correct. And they're monitored also.
Right. Well, both Medicare supplements and Medicare Advantage plans, those plans are approved by Medicare.
Okay. So you know you're pretty safe if you stick to one of those.
You're safe with that. So with supplements, like I said, there's 10 different supplements. With Advantage plans in Allen County right now, we have 14 Advantage plans that are available that have prescription drugs in them. We have 4 plans that don't. Okay. So take a look at it, determine which type of plan would be best for them, and then we go through a series of questions to determine what's going to be the best way to go.
You know, I think what's maybe important that we continue to share with people, Greg, and I think you'll agree with me, is it's going to be different for every person. So don't necessarily listen to what your neighbor says or Aunt Mabel or whatever else, because it's your situation. I mean, if you're a pretty healthy person, maybe your prescription drug supplement or insurance isn't that important, or maybe you do have a lot of serious health issues, so the hospital part might be more important. Is that true, Greg?
Well, a lot of it is determined by your health history.
So you look at your drugs first.
That's how I
Drug
start.
cost.
I look
Okay.
at the drug cost, see what plans cover what drugs, because
Okay.
not all of them cover each and every drug. It's not unusual at all for me to have a husband and wife on 2 different plans,
Yes.
simply to cover their drugs more efficiently.
Okay. So when you look at that insurance policy, you can also see a list of drugs that are covered.
Yes,
Okay.
and that's an important factor in determining what plan works best for you.
Okay, we do have a phone call now. We have Christine on the line. Hi, Christine. How are you tonight?
I'm good. How are you?
I'm excellent. How can we help you? Greg's got the answers.
Well, I've had an Advantage plan for 3 years, and I want to go to a supplement next year,
Okay.
but they're telling me because I have pre-existing conditions that I can only go with United Healthcare. Is that true?
It depends on your pre-existing conditions. What happens, because supplements are optional coverages, they are allowed to ask you health questions, and the insurance companies can accept or decline you based on your answers. So if you have pre-existing conditions, it doesn't necessarily exclude you from coverage, but some companies are going to be tougher to get into than others. It is true that we do have a plan, and United Healthcare is one, where it's easier to get coverage than some of the others.
Does that help you out, Christine?
Yes. Yes. Thank
Okay.
you very much.
Yeah, and again, that just points out your situation. You've been with one plan for 3 years, but now you're deciding you want to switch to something else. Can you switch every year if you want to?
Oh yeah, you can switch
Is
every
your
year.
c-
With Advantage plans, you can switch during the enrollment period. With Medicare supplements, you don't even need to wait for the
For the
year end.
enrollment period.
You can do
anytime
that anytime
during the year. So
Anytime.
if you have a different situation or different medical issues, that's when you might want to make a change. We have Jim on the line. Jim, thank you so much for watching Senior Spotlight. And how can Greg help you tonight?
Yes, I'm a Vietnam veteran. I'm 65, getting ready to retire, and right now I've been going to the VA for treatments, and I have received treatments from them, and also I get my meds through them. Is it advantageous for me to sign up for B, C, D, F, any of these?
In my opinion, yes. And the reason I say that is, with a veteran, you're able to go to not only the VA, but you can go to a hospital outside of that. B allows you to see doctors outside of it as well. Now, you don't have to sign up for B if you're just going to go to the VA. But if indeed down the line you want to change that, you will have a penalty to re-enroll in B, and that penalty is 10% for every 12-month period that you're out. So that's a decision you need to make. And I know I've talked with some vets that have been out for 10, 12 years, and they're thinking, okay, I want to go back to B. Well, you can. Just keep in mind that you're going to have a penalty to be able to do that.
Okay, I hope that helps you, Jim.
Yes, it does.
Stick around. We might have more answers for you here in the next few minutes. I do want to show a slide here tonight with a website where you can get a lot of information as well, and that is Medicare.gov. And that's an important resource as well. Perhaps there's more information or simplified information as to what's also in this manual. Plus, if this isn't handy and you want to look something up, I just get on the computer.
Medicare.gov is a great website, and for those who like to go online and find out answers, Medicare.gov is a place I go. I'm able to go there, enter in a person's prescription drugs, compare them, how they look with plan to plan, see if they have any step therapy, quantity limits on those drugs, and then also on Advantage plans, compare what the health benefits are.
Okay, can a person do that? I mean, I know you can do it more because you know how to do it, but can you research a little bit yourself?
Absolutely. They have all the information for the plans there.
Okay.
It is
For every plan that's available?
Every plan that's
Like
available.
if you went into Indiana,
What
or
happens,
Fort Wayne, would they have all 14?
What happens is you enter your zip code in.
Okay.
You go through a series of some questions, but they're easy questions to answer. And Then they will line up. You're able to put in your drugs at that point. Click a couple of screens, and like I said, it's very easy to navigate, and you'll be able to see the plans that are there. If there's a particular plan that you want more details on, you click the name, that information will come up. So it really is a great place to get detailed information on all the different plans.
You know, Greg, I think what's important to a lot of people are some of the separate issues. I mean, we've talked about going to the hospital, talked about medications, but what if you have issues that involve vision or dental? What's the situation there? What does Medicare cover, and what kind of insurance would you need to purchase yourself to give you some of that coverage? Can you help us there, Greg?
Dental insurance.
Yeah.
Yes. Gosh, when we get older, we want dental insurance, right?
I mean, dental and vision are both
dental
more
and
important
vision.
as you
Okay.
get older.
Here's what Medicare does a good job on diseases of the eye.
Okay.
So if you have cataracts, glaucoma, macular degeneration, these are all things that Medicare covers well.
But not a regular appointment and a
not
prescription checkup.
No, not a routine vision checkup. They do not. Same way with dental. Gosh, as we get older, caps, root canals,
Yeah.
bridges, those are all things that people have questions about. There's no great plans out there for that. I sell
Yeah.
them, and because there's some people who really have a need here, unfortunately, the coverages are not as good as it would be with a group plan. So if someone
Right.
is used to a group plan with
While
very
they were
comprehensive
working.
dental benefits,
Yeah.
these plans aren't as good. Now, I always look at it, can I get my money back out of these plans?
Right.
If I'm paying a premium, what am I getting in return for that coverage?
Right.
And if you're getting a lot of benefits or you really do need a lot of services, can you get your money back? Yes. And it can be a good deal. For most folks, unfortunately, I don't think they're a great buy.
So, you know, get what coverage you can and then be
Right.
prepared
They-
financially for those root
Exactly.
canals or
Exactly.
separate situations. Terry, thank you for calling tonight. How can Greg answer your question? Are you with us, Terry?
Yes, ma'am.
Okay. You're a vet as well, I hear.
Yes, ma'am.
Thank you for your service. How can Greg answer and help you out?
Well, I'm wanting to know whether I should stay with the VA or do something else.
Terry, are you
This
on
Obamacare, this extra?
Terry, are you on Medicare at this point?
No, ma'am.
Okay.
I only go to the VA. Well, I absolutely do have no trust for a doctor.
Okay. How long have you been receiving disability?
About 18 months.
Oh,
Okay.
fairly recently then.
Okay.
And I think that, you know, one of Terry's concerns too is whether Obamacare or Affordable Care Act is going to affect him as a vet or our general population out here. How would you answer that?
Well, for you, Terry, since you're going to be on Medicare in 6 months, what I would do is continue with the VA up until that point, then enroll in Medicare. At that point, Terry, if you don't mind my asking, how old are you?
I will be 62 June 21st.
Okay. What I would suggest you do, once you get your Medicare card, I would check out the Medicare Advantage plans in addition to the VA. It just gives you some additional coverages, and the premiums on some of these plans are extremely low. So it would make sense to have both, and like I said, it's really not going to cost you much at all.
So you would talk to an insurance professional that really understands the Medicare situation like you and find out what kind of plan is going to work best for Terry.
And the nice thing about what you have, Terry, is that you have options that some of us don't have, and so it really is a nice deal for you. You can use the VA, and you could use some of the doctors outside of it if you choose to.
Okay. We have Carol on the line as well tonight. Carol, thank you so much for calling. And what is your question?
Yes, I have Medicare and a supplement, and I also have the Part D for the prescription coverage.
Mm-hmm.
And I've now fallen into that, what they call that donut
The
hole. I
donut
guess
hole.
it is.
Yeah.
And I'm diabetic, and my insulin, I have to take 2 different insulins, and it's just
Pretty expensive.
Real expensive. I mean, you know, I just have my Social Security, and and coming up, my drug plan is going to go up along with the deductible, and so, you know, for 3 months here now, I have to pay full price for my.
Wow.
And then at the beginning of the year, I have to start all over with a $350 deductible for, you know, 1 month will get my
Pretty tough.
deductible, you know. So,
Carol, let me see how Greg might guide you. And I'm sorry to interrupt you, but we're very close to the end of the show, and I want to make sure that Greg can give you some guidance.
Carol, for one thing, the donut hole is determined, it's a fixed number for next year, it's $2,850, and that's regardless of what plan you're on, and they're going to count the full cost of the drug, it's not what you're paying for it. So regardless of the plan you're on, you're probably going to hit the donut hole about the same time. Having said that, do a review of your prescription drug plan. See what is available for you, because you might find that some of the costs getting to the donut hole will be lower with some plans than another. Once you're in the hole, you will pay, it's 47.5% for your insulin next year. For generic drugs, it'll be 72%. Some plans actually do cover some generics through the gap. So check that out, and I really would do a review of your plan to see if you can save some money.
Okay, good advice, Greg. I do want to remind you of that website again. If you have more questions about Medicare and you can't find your book or don't understand it, that's medicare.gov. And also want to encourage you to seek out a specialist like Greg. And if you want to talk to him, call back right after the show and we'll give you a contact telephone number. Now, next week on Senior Spotlight, we're going to be talking about elder law issues. Elder law issues. A lot of things come up when you get older, don't they, Greg?
They do. They do.
Oh, well, so much for that. We're going to think young tonight and have a great time. I hope that you do too. We'll see you next Wednesday night.